As we know that WHO estimated that there were about 62 million people with moderate to severe COPD in 2002, with the total number of COPD cases predicted to increase to about 200 million in 2010, and COPD is currently rated the fourth most common specific cause of death globally and predicted to be the third by 2030. And in the absence of interventions that address the risk, especially tobacco smoking, exposures to combustion products of biomass fuels and environmental pollutions, the WHO has estimated that many of AIG groups to 70% of COPD deaths are related to tobacco smoking. Meanwhile, it has been estimated that despite the high prevalence of COPD in some HIC, 90% of COPD deaths will occur in low and middle income countries, or MIC, and 40% of these deaths are related to smoking. So in Indonesia, based on data released by the Ministry of Health in 2013, the COPD prevalence is 3.7% per mile in subjects with age more than 30 years old, especially in male. Smoking behaviors among people aged more than 15 years is 36.3%, and 64.9% are male, and the average number of cigarette smoke was about 12.3. In recent years, a solution has been developed in the form of questionnaires, generic and specific, examining the quality of life, or QOL, and health status, and these have been used in patients suffering from respiratory conditions, especially asthma and COPD. And the purpose of our study here is to determine the smoking behaviors and its characteristic among COPD patients in Persahabatan Hospital, Jakarta. We conduct an administered questionnaire-based study carried out in Indonesia between May and June 2016 in Persahabatan Hospital, Jakarta, among patients with previous diagnosis of COPD. All patients were stable. A total of 11 doctors contribute to the recruitment, and diagnosis and severity of the obstructions were established using the GOLD criteria. And no spirometry was carried out during the study. To be included, patients had to have a previous diagnosis of spirometry confirmed COPD. The values of this spirometry were used as reference values for establishing the severity according to the GOLD classifications. These are the inclusion and exclusion criteria. For the inclusion, the patient must have diagnosed COPD in stages 1 to 4, have stable by the time questionnaire is complete, have given their informed consent. And the exclusion criteria are terminal illness, diagnosed psychiatric conditions, or any other conditions that modifies perceived health status for that prevents informed consent from being given, and inability to understand spoken or written bahasa. All of the subjects in the study are men with age more than 60 years old as the highest group, and the study has similar results, with studies report that the age-adjusted prevalence was higher for men than women in every city sample. Taking from this study, ranging from 11.4% of men to 7.5% of women in Mexico City, to 20% of men and 11.6% of women in Montevideo. But our study also mentioned about the tendency of COPD prevalence related to gender, as most studies have also either had small sample sizes or not enough women to allow for accurate comparisons. For example, the number of women in key COPD clinical trials was ranged from 0 to 35%, similar with our study. Recent work has suggested that while the overall prevalence and incidence of COPD are higher in men, incidence of COPD in younger age group is now much higher in women. Women may be more susceptible to developing COPD. They are more likely to express the airway predominant subtype and report more severe symptoms and activity intolerance. In this study, most of subjects started smoking at age 10 to 20 years old. It is transitions or adolescence age when they start to associate widely, and this result may be related to the reason to start smoking most is because of their friends who had smoked before. And COPD often manifests itself after someone has been smoking more than 20 cigarettes a day over 20 years. A smoker who is sensitive to cigarette smoke may therefore have spirometric changes between the age of 40 to 45 years if they start smoking as teenager. It has been estimated that 15 to 20% of smokers develop COPD. Those who start smoking it at an early age might have tendency to have longer durations of smoking if they do not start smoking cessations. It is shown from this study, the durations of smoking most more than 30 years, with 51.28% subjects included in severe group of Brickman Index, and Kratek cigarettes, or we sometimes revert as closed cigarettes in Indonesia, originating from here, from our country, Indonesia, and typically contain a mixture of tobacco, cloves, and other additives. And this type of cigarette is the most preferred by smokers in this study. One study conducted by Hers et al. Found that parental history of smoking was more common than parental history of COPD. 30.8% control subjects with and family history of COPD is the strong risk factor for COPD. Independent of family history of smoking, personal lifetime smoking, or childhood ETS exposure. In our study, we found whether subject as family member or head of family, there are 72.09% and 90.47% respectively, or 1 to 3 smokers in one family. Most subjects diagnosed with COPD at the age more than 40 years old, with the Group D gold classifications as the largest, while other study conducted by Sunmi Koi et al. In Korea stated that median age of patient in their study was 64 years old, with the Group A gold classification as the most. This difference might be due to difference in type and length of exposure cigarettes or biomass in both countries. In our study, the largest group of smoking status was the ex-smoker group. Most subjects stopped smoking at age more than 40 years old, and most of the reason they quit smoking is because of their disease. With smoking cessations effort for 1 to 3 times, and this result is similar with prospective study conducted by Richard Daw mentioned subjects who stopped smoking in the later middle age did so because they were already ill. Our subjects' knowledge of danger of smoking most is cancer, while their opinion regarding the image effect on cigarette packs of for smoking cessation effort, most of subjects say it doesn't affect people to stop smoking. And this result is contrary to one study observed an associations between pictographic health warnings and intent to quit smoking among women, with warning having a greater impact among women with less education and who had attempt to quit smoking. So the conclusions of this study are early age of smoking and later age of quitting. Friend as the reason to start, Kratek or clove cigarettes as the most widely used, high prevalence of smokers in one family, and image of cigarette packs which do not affect people to quit smoking are some of the characteristics of COPD patients in our study, which may be a picture of the behavior of COPD patients in wider populations in Indonesia. And also school, family, and community-based educations are very important tools to give information regarding the danger of smoking to reduce the incidence of COPD. Thank you.
Thank you very much for your presentation. Any question goes to our presenter?
I have one.
Yes.
You mentioned clove cigarette.
Yes.
Do you have a study comparing clove cigarette to regular tobacco cigarette?
Yes, actually, we do have some study in Indonesia regarding those. If you compare a clove cigarette user with common cigarette, and in Indonesia, mostly the smokers use the clove cigarettes rather than common cigarettes.
Whether it's more toxic or more
Yes, it
injurious
is.
compared to
Yes, it
smoke?
is. Yes.
Okay, as you say that most of the COPD patient has grade category C and D.
Yes.
And how many percentage of them
D,
will...
actually D.
Actually D.
D.
Okay. All right. Any more question? No? Okay. Is Dr. Park here?
Okay, thank you.
Okay.
Okay, thank you. The next speaker will be speaking about clinical